Hi, my name is Dr. John Luehr, and I'm a psychiatrist here at Sonder Behavioral Health and Wellness. Today I'd like to talk to you about depression and a new excellent treatment for depression called transcranial magnetic stimulation, or TMS. We know that depression is a biochemical misfunction of the brain, and through the years we have had multiple interventions, largely with our antidepressants, and they have grown and become more and more effective. However, for a large portion of people, antidepressants aren't the solution. And with our antidepressants through the years, we've always thought of the chemical side. Well, with the TMS, this is focusing more on the electromagnetic side. And what we've found is by using magnetic pulses to stimulate a specific part of the brain, those circuits connect with other circuits and connect into the inner or deeper brain, and it results in an improvement in depression. TMS was actually approved in 2008, and yet I feel like it's the newest treatment for depression that nobody's ever heard about. One of the things we do at Sonder is to measure to find the exact treatment location. And to do this, we take landmarks from people having an EEG and doing the actual measuring on their head so that we can identify the best spot in the dorsolateral prefrontal cortex to target these magnetic signals. So the typical treatment is 36 treatments, and insurance pays for one a day. So that ends up being over 7 weeks of coming to our lovely clinic and sitting with our treaters and getting about a 20-minute TMS treatment. More recently, we became interested in an accelerated TMS protocol. In that protocol, we do 36 treatments all in 1 week. We were able to publish this study, and the results were very promising. With TMS, it is really clean. You come, you sit in the chair for 20 minutes, have the magnetic treatments, and you're up and ready to go. Another thing about TMS is we know that it's FDA approved and very helpful for depression. It's also been approved for anxious depression. And more recently, it has been approved for OCD, and it has been approved for adolescents 15 and up. Now, TMS is covered by virtually every insurance, including Medicare and medical assistance. And I would tell you that some of our newer medications cost more in a year than a TMS treatment course does. We had a depressed person who did really well with TMS, and he had been in the military. He described depression as having that 80-pound rucksack or 80-pound backpack, and you had to carry it everywhere. So that heaviness did not leave him when he went into the shower, or he went to bed, or he went to the grocery store. It was always there. And I think that's a good analogy of how serious depression can be. We hope you'll consider looking into Sonder Behavioral Health and Wellness for TMS, and consider looking at our accelerated TMS.